everyone, welcome back to the Afro Nurse International YouTube channel, and thank you for joining me today. So first, I want to say thank you for your patience. I know many of you have been messaging me and asking when we're going to start the NCLEX Bootcamp or the group or information. I've been taking my time to prepare this thing because if you have watched my previous videos, I've emphasized that the NCLEX is not something you want to rush. You want to take your time. You want to study because it's different. It's different from the Nursing Council. The method, the questions, what they're testing for, it's very unique. So you need time to prepare. And I'm not in a rush, and you shouldn't be in a rush either. Like right now, you should be more focused on getting your application approved if you are applying for Nova Scotia. And getting through that process, because Nova Scotia has given you the opportunity to come over there, get your license, start working before you write this exam. So just slow down, take it easy, okay? Don't be in a hurry, because many people write the NCLEX and they fail. And I'll tell you why someday. But one reason is that they're not ready. They don't prepare well enough. Okay, so I have not forgotten about you, and I will be, making things available, and I will let you know, but do not be in a hurry, okay? So but I want to say thank you for your patience. Thank you for being part of this channel. Thank you for your words of encouragement. Thank you for your comments. Thank you for being there, okay? And we will get through this together. And so without further delay, let's dive right into it. So today I am going to be giving you information, everything you need to know about the National Council licensure exam for registered nurses, which is NCLEX. So if you've never had any plan to practice in Canada, US, or Australia, you might never have heard of the NCLEX, because this exam is just like the Nursing Council exam, which every nurse in Nigeria must write to get licensure or registration to become a nurse. So the NCLEX it was predominantly used in the United States of America, and in 2015 it was adopted by Canada. I actually was among the first people in Canada to write that exam in 2015. And then recently in 2020, Australia also adopted this exam. So it's really important for nurses from Africa and Nigeria to be familiar with this exam. Now, there are two types of NCLEX. There's an NCLEX for registered nurses, and then there's an NCLEX for practical nurses. So as a nurse from Nigeria, you want to be registering for the NCLEX for registered nurses, okay? So like I said, the NCLEX is used to determine that a nurse is safe to practice. So it's your final proof that you were safe and competent and able to do your job. So the NCLEX measures the competencies needed, the bare minimum needed to practice safely and effectively as a newly registered nurse. So the goal of the NCLEX is that when you sit for this exam, that you're competent. So the NCLEX level is basically that of a newly graduated nurse from Canada, US, or Australia. And the exam basically helps the regulatory body to decide that you are competent and safe to practice. So that's just basically what it is. It's exactly the same thing like the nursing council. If you don't write it and pass the nursing council, you don't get registered as a nurse. Even if you pass your school exam, the final test is the nursing council. But the NCLEX is different from the nursing council. And I'll be showing you and telling you why. So next, we're going to be talking about the test plan. What are the components of this exam? What do you need to know? Because it's important for you to know what to expect, what this exam is testing for in order for you to pass. So we're going to be talking about what you find, what are the components, also known as a test plan. So the biggest component of the NCLEX is the priority, which is client's need. So client needs, which is what the patient wants, because nursing is all about patient care, and you're taking care of the patient as a whole person. Now, when we talk about client needs in NCLEX, in the context, we are not just talking about an individual patient. So it could be a patient, it could be the family, it could be the community, it could be the public. So clients in this context, what the NCLEX is testing for is the patient need, the family need, the community need, the public need. Just anybody who is receiving care is a client. Now, there are 4 components of the client's needs that are being tested in the NCLEX. Now, each one has its specific thing that the exam is that you expected to know. And as a new graduated nurse, you've done this in school. So the test is verifying that you're competent in these 4 components of client's need. So the first component of client's need is safe and effective care environment. So one of the 4 components of client need that are being tested is that you as a nurse, you are competent and able to provide a safe and effective care environment for the clients. Now, there are 2 subcategories in providing a safe and effective care environment. And these are management of care, which tests your ability to provide direct nursing care that promotes safety for the patient and also for other healthcare providers around you. And the second subcategory is that you're able to provide safety and also infection control. So, which means that you're able to provide a safe environment that protects the clients and other healthcare providers from harm and environmental hazards. Okay. Now, the second component of client need is the health promotion and maintenance. So, this component is testing your ability to provide care in the development of the client or the community. So, this is more like public health, prevention and developmental growth and everything you can think about in public health, basically. And then the third component is psychosocial integrity. And this tests your ability to promote mental, social, and the social well-being of the patient. So this is more like mental health, you know, and patients undergoing psychiatric illnesses or stressful situation, just generally mental health. Okay. Then the fourth component of client need is a very important component, which which is physiological integrity. So this basically tests your ability to provide basic nursing care. So this tests your ability to provide basic care and comfort, your ability to provide pharmacological and parenteral therapies. So this is where your pharmacology comes in, and medications and everything like that. And also test your ability to reduce risk for clients. So these are maybe clients that already have illnesses, your ability to reduce their risk of complications. And then it also goes further to test your ability to provide physiological adaptation, like provide nursing care that encourages physiological adaptations for your patients. So let's say patients that have chronic illnesses, so your ability to help them, live with it to the best of, the best care and the best level of care that they can achieve while living with a chronic illness. Now, in addition to client needs, there are other components of the NCLEX that are not really specific, that doesn't fall into client needs. And these are, called the integrated processes. So these are concepts that applies to nursing. And one of those concepts is caring. So the questions are going to be testing your ability to provide care, to provide quality care. And it's going to also test your ability to make clinical judgments. So clinical judgments are your ability to make the right decision with the assessments that you have. So let's say a patient comes in and they have such problems. Now, how you're able to take the assessments, the problem that they have, and you're able to make the best decision for that particular time. That is what it's referred to as a clinical judgment. And also very important is documentation and communication. So here in Canada, I know basically, because I've practiced in Nigeria, I've practiced in Canada, and I know that documentation is huge. It's big. Like if you don't document, it's almost like you didn't do it. And if you ever go to court for something, if it's not documented, it didn't happen. So here we document a lot of writing. Everything you do, even when your patient farts, if the patient mess, you write it down that the patient farted. Every single thing. And you have to learn to document in a very specific manner. And I'll be teaching that down the road in another video. Okay, so the NCLEX it's also testing your ability to communicate and document. So communication is also very huge in nursing, because you want to communicate to your patients, you want to communicate with the family, you want to communicate with your fellow co-workers, you want to pass message, you want to receive messages. So the concept of communication is embedded in the NCLEX, and the questions also have the questions that you get also, some of them requires you to know, to be competent, to know how to communicate and how to document your practice and your nursing care. And another integrated process that you can find in NCLEX is spirituality and culture. Yes, this is huge here in North America, because with patients, we have people coming from different cultures, with different spiritual practices and religious beliefs. So we have to accommodate them. You have to provide the kind of care um, that accommodates your patient's beliefs. And this is, something that you call like culturally sensitive care. And down the road, you learn about this more. And also, we live in a country that has indigenous people, and one of the biggest thing in Canada right now as a nurse is for you to learn how to provide a culturally sensitive care for these patients. And the final two integrated processes that you find in the NCLEX is the nursing process and also teaching and learning. So you all know about the nursing process, which is like assessment, making a nursing diagnosis, making planning, and implementing your plan and evaluating your plan. So all these things will come. You'll find this in the questions, and then also teaching, lots of teaching. And you teach your patients about medication, you teach them about post-op care. So you will find questions like this in the NCLEX. And yeah, and the third important thing you'll find in NCLEX is clinical judgment. Now, clinical judgment is so huge because the questions mostly in NCLEX is mostly, you know, testing your clinical judgment. So you may have a question. It's very rare for you to have a question that say, oh, if a patient come in here, should you give this or should you give that, or what is this, or what is the, what is it? Just straightforward questions. You may not find them. So the questions you're gonna find in NCLEX are asking or like seeking to know you if you have the capacity to provide clinical judgment, like to make the right decision, to prioritize care. Like if patient comes with something, what would you do first? Some of the questions, the answer, the options are all correct. You just have to choose the appropriate answer for that particular moment, for that particular situation. So even though the other answers are all correct, but one is the best. One shows that you have you're making a good clinical judgment, and that's what the NCLEX wants to know. And the new NCLEX, the next generation NCLEX, which was recently launched in April of this year, 2023, also tests your ability to, decision making, to make decisions, and critical thinking. So this critical thinking is also related to clinical judgment. So you critically think and then you make a judgment. So it's really, really huge on this. And then finally, the NCLEX expect that you have a basic knowledge of other things, of other concepts such as social sciences, so things like psychology and sociology, and you have biological sciences like biology, chemistry, physics, and also physical sciences, which is like physics. So these are all basic science knowledge which we all have before we went to nursing school. So you're going to bring all this knowledge back into your practice, and this NCLEX exam want to test that you still know these things and you can apply them in your care. Now to recap, the four major components of the client's need that is being tested in NCLEX is the nurse's ability to provide safe and effective care environments, health promotion and maintenance, psychological integrity, and physiological integrity. Okay, so now we're going to move on to the next portion of this video. So now we're going to go ahead and talk about how the NCLEX is administered. And it is administered through a process known as computerized adaptive testing, so CAT. So it's it's just a process to that ensures that um, all the components that we talked about is like it's included in the exam, and that each candidate's ability is measured. So as you answer the questions, it learns your ability and gives you new questions based on your previous performance. So it's like kind of like an intelligent method or module. So the more, just to put it in very simple term, so the more you answer the questions, it gives you more questions based on your performance in the previous questions that you've answered. And I'll explain this further, okay? Yeah, so in simple word, it just gives you questions based on your ability. That's just simple. Yeah. So just to give you an example, let's say you're answering these questions and you're getting the questions correct. So when you answer a question correctly, it will give you a question that's harder. Now, if you answer it correctly, it will give you another one that's harder. Now, all these questions will contain all the components that we have talked about. So saying that the next question you're going to get might be difficult is just that it may not be difficult because it's testing a different type of component, but because you passed or you answered correctly the previous question, the next one is going to give to you is going to be higher level. So you end up answering like, you know, more difficult questions based on your previous answers. So now if your previous and let's say you're getting them wrong, right? It will just keep giving you like easier questions. But you think that that's a good thing. No, that is not a good thing, because if you're getting them wrong and then it's giving you easier questions, then you are not basically meeting the passing point. And then that's where you have problems. So you want to get questions right, you want to answer more advanced questions. And yeah, so this is why it's given the term of it's an adaptive test, because it adapts to your ability. And this is really good because it helps to actually truly measure your ability to answer these questions. And it's also very difficult to cheat because you don't know what you're gonna get, and the questions are different for everybody based on their ability, so you can't really go in thinking you're gonna cheat because it's not possible. So the total exam, there is a minimum of 85 questions and a maximum of 150 questions. Now, some people can go in there and start writing, and the exam shuts off at 85 and they pass. So what happens in that case is that they're getting all the questions ready, and by the time they get to 85, the computer has already given them all the questions from all the components, and they passed most of them. So they keep staying, because there's a passing mark, and they stay above that passing mark, until the 85th questions, and then it shuts off and then they pass. However, the fact that your exam shuts off at 85 questions doesn't always mean you pass, because if you keep staying below the passing points or mark, and you keep answering easy questions but you're not passing that mark, you keep staying at the lower level, by 85 questions you can still be shut down because you never passed it, so you fail. However, some people can have all 150 questions, but which can be written in 5 hours. So you allotted 5 hours total to write this exam. So what happens when people continue to use up 5 hours is that they keep getting some questions right, wrong, they keep getting, so they just staying above the passing mark, and also sometimes they stay below it but they still stay above it. So the computer has not really is not able to decide whether they pass or not. Okay, they cannot keep going, and then at that point they will use a different method, which I'm going to be talking about in a few minutes, to determine whether the person passes or fails. Now, it's important to know that the 5 hours that you have to write this exam also includes breaks. So when your exam is taking this long and you have to go use the washroom or the bathroom, your time is going. It's not gonna stop. It includes your break. Okay. So the bottom line is to say that whether you finish your exam at 85 questions, which used to be 75 questions before, but now it's 85, or you finish at 150 questions, it doesn't matter. You could pass or fail in either of those cases. So your best bet is to get your answers correctly, and then you can finish at 85 questions or a little bit more, or you can have the whole 150 questions. Now, there are 3 ways to pass or fail the NCLEX, and the first one is the most common method, and it's known as the 95% confidence interval rule. So if the computer is like sure that your you consistently keep, stay above that passing mark, passing level, and the computer is like complete 95% sure that yes, you know what you're doing, then you pass. So once you stay above this passing standard, the computer is sure, and then the computer will just stop giving you questions because they say like, okay, yeah, you know what you're doing, done, you pass. And the second scenario is a maximum length exam. So this is when the candidate, like I've talked about this before, when the candidate continues to stay, very close to the passing standard or just above it, just to keep going above it and then a little bit below, like above it, and the computer it's like, okay, I'm not sure what's going on here, but you're doing great, but I'm not really sure, but I'm just gonna keep giving you questions, and then keep giving you questions, and then in the end, if you continue to stay above it, then you pass. But by this time, you've already had like 150 questions and maybe used up all your hours. And then the final method to determine pass or fail is when you run out of time. You don't want this to happen to you. But if it does happen to you, then the computer will determine if you meet the 95% pass rate, like if the computer is 95% sure that you've answered all the required items, and then it would see that if you were able to answer all the required items and you run out of time, then it will grade you based on how many of those items you've answered before you run out of time. Now, if you answered everything and they are correct, then you will pass. However, if you didn't answer the required amount of items and you run out of time, unfortunately, it's not a good news. Anyway, this is just in a nutshell what the NCLEX is all about, and it's different from the Nursing and Midwifery Council because it's testing all these components that we've talked about, and it's very adaptive, so it gives you questions based on your ability, and it's very, very unique, and it's foolproof and everything. So we're gonna have a boot camp. I will give you information about it. I'm just waiting on some things, and also waiting to arrange things with the specialist who is in charge of this NCLEX strategy that I told you about. You will be the first to know when this happens, and then I'm going to be sharing a new video soon about some of the questions you can find in the NCLEX, like the components, more components that you can expect. So for now, just you can start studying if you want, but I'm gonna make another video. So this video is basically just to tell you what the NCLEX is all about, because for most of us in Nigeria, we don't use NCLEX, so we don't know, but now you know. Now, if you want to find more information about NCLEX, go to the NCLEX website and download the test plan, and it will give you more information. I will leave a link below so that you can go there. But if you have any questions, please write in the comments, and I'll make a new video very shortly. Okay, so thank you. And once we have a date for the strategy bootcamp, for the NCLEX strategy bootcamp, you will be the first to know. So if you've not subscribed to this channel, please do so and like it, and so you can be notified when I put out that announcement. And for all of you who have sent me your email address to be added to the group, be sure that you'll be added. And also there's gonna be a link below to sign up for that bootcamp if you're interested. Okay, yes, there's gonna be an NCLEX bootcamp. There will be a link below this video, so just go to the link and leave your name and